Hi, this is Jill Murphy from Contemporary Clinic. Before we get started today, one of our top stories on Contemporary Clinic is about a study involving peanut allergies driven by the fear of accidental exposure and allergic reaction. Today I'm speaking with Kelli Garber, lead nurse practitioner for school-based health and the Center for Telehealth at the Medical University of South Carolina and NAPNAP member, about the growth of telehealth and what healthcare professionals and nurse practitioners should consider when using telehealth. How are you doing, Kelli?
Hi, I'm well. How are you?
I'm good. Thank you for joining me. So, my first question for you is, can you give me a quick overview of your role at NAPNAP and all of your experience leading up to this point?
Sure. I'd be happy to. So I've been a pediatric nurse practitioner now for over 24 years. Don't do any math to figure out my age, but it's been a long time. And I've worked in both private practice and school-based settings for most of my career. I've been in the world of telehealth for about 6 years now with the Medical University of South Carolina. And my role with NAPNAP, I've had a lot of different roles. I am currently the past president for the South Carolina chapter, and I'm the legislative chair for the South Carolina chapter of NAPNAP as well. And I also represent NAPNAP as the liaison to the American Academy of Pediatrics Section on Telehealth Care Executive Committee. So I'm really excited to be here with you today to talk about telehealth, which is something I'm very passionate about.
And with that being said, how have you seen telehealth grow from when you first got into your career compared to now with all of your experience?
So I had to chuckle thinking about that question. When I went to school, computers were just kind of getting started in healthcare. So I am certain that when I started in this field, I could never have dreamed what we can do today with telehealth. The idea of digital stethoscopes, otoscopes, and exam cameras wasn't even something I thought was feasible, or at least in my lifetime. So I've really seen this incredible change and what really is probably a short period of time. So in the last 6 years in particular, when I started, there wasn't a lot about telehealth in the literature. So I sort of had to learn on my own and develop best practices and workflows and things, as I was the first person in my role at MUSC. And now there's just such interest in telehealth, and of course in light of COVID-19, huge expansion. So I've gone from having to convince people you can do it to really sort of being able to say, yes, you can, and do it well, and let's talk more. So it's been a huge shift really in the past probably 6 months.
That was actually my next question, considering this pandemic going on. Have you seen anything specifically changing with telehealth, considering everything that's happened with COVID?
Sure. Yeah, I mean, really has dramatically changed for quite a while. Many providers that I would interact with or when I would present at conferences would be very skeptical about telehealth. But what I think happened was, in light of COVID, in order to protect providers and patients from COVID and limit exposures, many just suddenly had to shift to telehealth and really didn't have another option. So when they started doing telehealth, they realized that you can do high quality care through telehealth, and it can reduce costs and be an advantage for the families. So I think what's happened now is providers are more willing to embrace it. However, without the changes that were made by CMS, both legal and regulatory and reimbursement related, I don't think we would have seen such wide expansion or rapid uptake of telehealth among providers, because prior to COVID, there were a lot of barriers to telehealth in terms of reimbursement, restrictions in some cases on the originating site or the patient location, and so on. So it's really opened the doors for telehealth to expand.
And with the expansion of telehealth, what are some things that you feel other healthcare professionals and nurse practitioners should consider when they use telehealth and want to incorporate it into their practice more?
Sure. The first thing I tell everybody is telehealth does not change our standard of care. It's the same evidence-based practice that we provide every day to our patients. We're just doing it through distance. And so you can do high quality care through video. Now, it's important to recognize that it isn't for everything. So there are times where a clinician or provider will need to say, I don't feel comfortable that I can meet standard of care through this modality. And then we facilitate the patient getting to the most appropriate location in person to have that care. But there are many things that we can treat and treat well through telehealth. And so it's also important for providers to be very aware of their telepresence, or telehealth etiquette, as we like to call it. it's necessary that we be intentional about the interactions with patients. We need to make eye contact looking into the camera. We need to make sure that we dress professionally and that we give the patients time to respond and ask questions, and to ensure that they have a way to follow up with us once the visit is closed. And a lot of these things might seem, common or easy, but so many people are used to casual video platforms like Facebook, or excuse me, FaceTime and others. So when doing a telehealth visit, we have to be very intentional about maintaining that professional relationship and building that rapport and sharing empathy with patients. It's just such a key component to the visits and the care that we provide every day. And we don't want to forget that when we're doing telehealth.
And in terms of working with pediatrics, how does telehealth benefit those patients, and how can it continue to benefit patients from your own experience?
There's so many benefits to telehealth. I think first and foremost, it really increases access to care for many children, particularly in rural and underserved areas. It can provide cost savings to families by reducing the cost of travel and time missed from work to take their child to a healthcare provider. It also can improve outcomes by ensuring that children get the recommended follow-ups that are necessary, by removing those barriers such as travel. So there's many, many benefits to telehealth for pediatric care. Particularly, I work in school-based telehealth. And so in many of the schools that we serve, the school nurse is actually the only provider, healthcare provider, that a child ever sees. And so bringing telehealth into the school expands the scope of care that that child can receive right there in the school system. And so we bring the expertise of pediatric nurse practitioners and pediatricians right to the child where they are every day. So we can, work with them not only on acute visits, but management of chronic conditions such as asthma or ADHD. And so it really can enhance the care that a child receives. Now, in light of COVID, as many people have experienced, schools closed. And one of the benefits of telehealth is that we were able to quickly convert to being able to do video visits to the home for many of our children. For those that don't have access to video or cell phones or computers, we could also do some visits by telephone. So we were able to really extend that continuum of care from the school to the home and continue to manage the children that we normally see in our program. So telehealth is really, really a huge benefit for all children, but particularly for those in rural and underserved areas.
And with all those great benefits that you just mentioned, what do you hope to see for the future of pediatric nurse practitioners in terms of telehealth and the future of NAPNAP moving forward?
Sure. Well, I certainly hope to see telehealth continue to be part of the pediatric healthcare continuum. I think it makes such a difference for many families throughout our country. And as part of the National Association for Pediatric Nurse Practitioners, where we are experts in pediatrics and advocates for children, I would highly recommend that we all embrace telehealth so that we can improve access to care and help to improve health equity for all children.
Absolutely. Kelli, thank you so much for joining us. Now let's hear from some of our other MGH Life Sciences brands on their latest headlines.